Is the only way to correct horners is with an eye lift, or can the eyeball sinking back actually be fixed too? I have horners as a result of a surgery, and you can see that my right eye is tucked back a little as well as ptosis. Is it possible to fix the eye itself, or only a lift to fix the ptosis?
Thank you for your question. You state in your question that you have Horner syndrome related to a surgical procedure and that your eye is pushed inwards. And you're asking about whether you need to have surgery to push the eye outward versus surgery to lift the eye. So your situation really requires a full examination before you get a more complete or comprehensive question answered. The point is that it depends on the type of surgery you had that led to the Horner syndrome. If you had some kind of intracranial or neurosurgical procedure and that your eye is pushed in related to that, then we're talking about something that has to deal with the boney around the eye, the bones around the eyes, called the boney orbit. And that reconstruction can be very complex and may require a team approach between an orbital, oculoplastic surgeon, and neurosurgeon in order to achieve the restoration of the position of the eye. It may or may not be practical to do that. A lot of times in our practice, and I'm a practicing cosmetic oculofacial plastic surgeon in Manhattan and in Long Island for over 20 years, in patients who have either enophthalmos, which means the eye is pushed in, such as for yourself, or exophthalmos, where the eye is pushed out, and that's typically in a situation, a condition called Graves' disease or thyroid eye disease, we always have to think practically. In the real world and people's lives and being able to work and our goal is always to reduce risk. A lot of times eyelid surgery alone is a reasonable compromise because trying to achieve ideal may involve more risk than it is worth. So a lot of times if someone has, let's say for example, a thyroid eye disease patient has eyes that are bulging out very much and they don't like it, but then one eyelid is particularly high, I will offer the option of just bringing that eyelid down, and that's not a simple procedure, but it is less invasive than doing an orbital decompression. They may choose to do that, and when they see that their eyes are more symmetric, they're happy with the results, and then they don't feel like they need to do what is the classic approach in our field in terms of the textbook approach, which is first decompress the eye and then do eyelid surgery. Again, we have to deal with individual situations and of course risk and benefit. So in your situation, I think more detail is necessary and it should be brought to the attention of an oculoplastic or orbital surgeon. And if you had neurosurgery as I described, then it is something you should also discuss with your neurosurgeon about what the complexity would be of trying to get the eye back in normal position. The challenge a lot of times is when the eye recedes back, there's a lot of scar tissue that forms and it makes it very difficult, even with correction of the structure around the eye, for the eyeball to be moving forward. So it may still be more practical to have ptosis surgery to get the eyelid in a more natural, symmetric position. Whenever an individual has a problem like yours or variations, people are naturally always think that everyone's looking at them and sees that asymmetry so, like it's so glaringly obvious. But I always tell them that people look at you globally. And if you are able to create some balance, even with a 1 or 2 millimeters of correction, then everything else kind of averages out and it blends and it's easy to camouflage. So again, moving forward, meet with some doctors in the specialties I described, so that you can get more information. You may require imaging studies. You may need a lot more in order to figure out whether or not a more complex surgery in the orbit is necessary versus a more straightforward surgery that we routinely do in our office, whether it's to lift the eyelid or bring the eyelid down. It's considerably less risky. So once you have your information, move forward with whatever you're comfortable with. So I hope that was helpful. I wish you the best of luck, and thank you for your question.